undermine basic science in public health, who puts his own interests above the health and the well-being of others, for the health and well-being of all of our families, the people who count on us, to think about them in these rooms of power. I urge all of my colleagues on both sides of the aisle to look past politics and think of country and to find the moral courage to do what's right. Oppose this nomination.
Thank you, Senator Warnock. We now have not only a quorum, but all members of the committee are present. I move that the committee favorably report the nomination of the Honorable Robert F. Kennedy, Jr. of California to be Secretary of Health and Human Services. Is there a second? Second. There is a second. The clerk will call the roll.
Mr. Grassley.
Aye.
Mr. Grassley, aye. Mr. Cornyn.
Aye.
Mr. Cornyn, aye. Mr. Thune.
Aye.
Mr. Thune, aye. Mr. Scott.
Aye.
Mr. Scott, aye. Mr. Cassidy.
Aye.
Mr. Cassidy, aye. Mr. Langford.
Aye.
Mr. Langford, aye. Mr. Daines.
Aye.
Mr. Daines, aye. Mr. Young.
Aye.
Mr. Young, aye. Mr. Barrasso.
Aye.
Mr. Barrasso, aye. Mr. Johnson.
Aye.
Mr. Johnson, aye. Mr. Tillis.
Aye.
Mr. Tillis, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Marshall.
Aye.
Mr. Marshall, aye. Mr. Wyden.
No.
Mr. Wyden, no. Ms. Cantwell.
No.
Ms. Cantwell, no. Mr. Bennett. Mr. Bennett, no. Mr. Warner. Mr. Warner, no. Mr. Whitehouse. Mr. Whitehouse, no. Ms. Hassan. Ms. Hassan, no. Ms. Cortez Masto. Ms. Cortez Masto, no. Ms. Warren.
No.
Ms. Warren, no. Mr. Sanders.
No.
Mr. Sanders, no. Ms. Smith.
No.
Ms. Smith, no. Mr. Lujan.
No.
Mr. Lujan, no. Mr. Warnock.
No.
Mr. Warnock, no. Mr. Welch.
No.
Mr. Welch, no. Mr. Chairman.
Aye.
Chairman votes aye. Mr. Chairman, the final tally is 14 ayes, 13 nays.
The vote was, would the clerk please restate the vote?
Mr. Chairman, the final tally was 14 ayes, 13 nays.
The vote was 14-13. The nomination is reported favorably. We will now turn to other senators who would like to make a statement. Since I asked my Republican colleagues to hold off at the outset, I'll go to the Republican side next. First, Senator Tillis.
Thank you, Mr. Chairman. I voted aye today, and I want to just briefly explain why. I believe in my 65 years, I'll be 65 in August, that Mr. Kennedy will be one of the first people coming before who is, in fact, not a trained healthcare expert. He views this through the lens of an attorney. He's brought many lawsuits on food safety, vaccine safety, a number of other things. But, Mr. Chair, I think it was Senator Warnock that said that the president said he was going to go wild in the Department of Health and Human Services. I hope he does. I hope he goes wild and actually finds a way to reduce the cost of health care. I hope he goes wild, and instead of having the discussions that we have had for the 10 years that I've been in the Senate of making Medicaid work and making people on Medicaid healthier, I hope he goes wild and figures out how to do it, because the status quo has not achieved much in the way of gain. I hope he goes wild on food safety discussions so that we can actually improve our food safety supply. I hope he goes wild on the healthcare supply chains and, in fact, tries to make sure that drug prices go down instead of bludgeoning pharmaceutical companies, get everybody in the room and make sure that we do this right. Reduce the cost of bringing a vaccine to market, reduce the cost of bringing drugs and therapeutics to market. Look at the full supply chain, and somebody with a legal mind may do that. He is no health professional. In fact, he's the first, I believe, and since I've been alive, who's not been a healthcare professional in a scientific sense. But he is a professional in terms of carrying this forward and holding people accountable through the courts. But and also, Mr. Chair, I'm not going to go much longer, but I had a lot of people call me earlier. I had people from the agriculture industry call me and express concerns, but I'm not aware of any organized, credible group, the Farm Bureau, the Department of Ag Commissioners, or others, who have said that we should vote against Mr. Kennedy. I heard people express their concerns about his pro-choice position. And yet I haven't seen any pro-life organization score this vote or recommend that we should vote against it. I heard him call the NRA a terrorist organization. and yet the NRA is silent on his confirmation. And so I've heard him say that GMOs are a concern. Hopefully we can convince him that not all GMOs are. It's feeding the world. Corn, drought-resistant strains of healthy vegetables will move on. Protein producers were mad about lawsuits were brought against them, but there's been no organized opposition against them. And so maybe it is time to have a different kind of disruptor there. The only way that Senator Kennedy, the only way that Bobby Kennedy and I will get crosswise is if he does actually take a position against the safety of proven vaccines. That will be a problem for me. He answered a very important question to me during the hearing. I asked him specifically if it was his intent to let the scientists of the CDC, the NIH, BARDA, and other organizations to work independently. He said to me under oath that he would. If he fails to do that, that will be a concern for me and something I'll bring up in a future oversight hearing. But Mr. Chair, we have not made appreciable progress in Medicaid and improving the health of the population on Medicaid. We have a SNAP program that does have too much sugar and things that are eligible in that program that should be eliminated to make these people who are on free and reduced lunch healthier. We need to stop having full trash cans in public school cafeterias full of stuff that the kids aren't eating and figure out how those kids on free and reduced lunch actually have a healthier lifestyle. And so I, for one, think that it is time to put a disruptor in. It is time to put somebody in there that's going to go wild. But there are areas where I think that's exactly what we need. And there are areas of Health and Human Services that if you touch the gold standard for the NIH and the CDC, then I'll have a problem with that nominee, and we'll bring that up during oversight. But it was for those reasons. And the fact is that there's not a single organization that I consider to be credible in this space, in agriculture, in Second Amendment, or in pro-life, who have openly objected and scored this vote. I believe that silence is consent. And the fact that they haven't suggests to me that folks that I'm instructed by are okay with this nomination. And for those reasons, I voted for Mr. Kennedy.
Thank you, Senator Tillis. Senator Warren.
Thank you, Mr. Chairman. Since we had our hearing last week, Mr. Kennedy has amended his ethics agreement. Recall that his ethics agreement said that while he was Secretary of HHS, he intended to retain a financial interest in ongoing vaccine litigation that he was already collecting money from, and that he wanted to continue to collect that money even though he could affect the outcome of that litigation. Now, he has since changed his position on that. Once this has been exposed and people have talked about it and have some pretty serious reservations about his doing that, he has said that he will instead give his financial interest to his son. That is a fig leaf that is so small, it would take a magnifying glass to see it. No one is fooled about what's happening here. Mr. Kennedy refuses to say that he will not participate in these lawsuits financially the day after he leaves office. And yet, Mr. Kennedy has acknowledged, first, that the American people have a right to know that the decisions you're making are decisions that are in their interest, not in your future financial interest. He has said he thinks that's the right standard, and yet he has figured out how to make money off his anti-vax positions. He's already raked in $2.5 million. He is in a position where he can affect the outcomes by things he does as Secretary of HHS, and yet he refuses to say that he will delay by even a day taking on anti-vax lawsuits the minute he leaves. That is an appalling conflict of interest, and it's one in which the American people can reasonably ask, is Mr. Kennedy's plan to help the American people, or is he planning to use this job to further enrich himself, and he's pointed out with his son, and enrich his family? The importance of this litigation cannot be overstated. This is not only about a private company that gets sued and has to pay out. Vaccine manufacturers often operate on very slim profit margins. if they get sued repeatedly and successfully, they simply move out of the vaccine space. We've already seen this happen with vaccines in the past. 20 years ago, we watched vaccines just move away if they did not have protection from these kinds of lawsuits. The consequence of Mr. Kennedy's ability to make those lawsuits easier is also the ability to shut down access and manufacturing for vaccines for every one of us. And I think that's a terrible mistake.
Thank you. Senator Welch, did you wish to speak?
I did, yes, thank you. Thank you, Mr. Chairman, Mr. Ranking Member, and thank you, Mr. Ranking Member, for your statement. I want a disruptor in the healthcare system and one leading it. I don't want a destroyer. And there's three issues before any nominee that we have to consider. One is character, another is competence, and a third is priorities. We did not have Carolyn Kennedy here, but she gave a statement. And she said that Bobby was able to attract people through the strength of his personality, his willingness to take risk and break the rules. And those might be desirable qualities if it was accompanied by sober judgment and behavior, because the person who leads a major organization has to have the confidence of the people that work for him. And frankly, some of the things that he did that never explained, a chainsaw taken off the head of a whale, dumping a bear in Central Park for his own amusement. These are just weird things. And we never really got into the character issue of what is required for a person who runs such a major department. The competence question, this is all on a wing and a prayer and a hope. There's no record of Mr. Kennedy having experience in managing a large organization in medicine, no experience with science, and none of the prior experiences required not only to run a major organization, Health and Human Services, but also the CDC, the NIH, and all the other organizations that are under the umbrella of healthcare. And by the way, on the competence issue, let's be candid. This was a deal where Mr. Kennedy was running for president as a Democrat. He lost, and he approached President Trump to make a deal, and for political reasons, the deal was made, and the appointment was going to be that he's Health and Human Services. The president has a right to make that deal. Mr. Kennedy can seek it, but it doesn't translate into competence. And the third is priorities. The priority for Mr. Kennedy is about the vaccines and his theory of that. And we need reliable vaccines and not a conspiracy theorist on that. But you know, the healthcare system is not working for the American people. It is too costly. Our employers who care deeply about providing employer-sponsored health care can't afford these premiums. The folks who are getting their insurance on their own can't afford it. Even Obamacare is getting so expensive because the prices are escalating constantly with pharma expenses, with the providers having it, with private equity getting into healthcare. Mr. Kennedy's priority was about his view of vaccines. It was not about making healthcare more affordable and accessible. And in response to really a very direct and easy open-ended question from Senator Cassidy, Mr. Kennedy showed a woeful ignorance, even between the difference between Medicare and Medicaid. So we have a healthcare system that is not serving, as it should, the interest of American citizens, of American businesses, and American taxpayers. And I, after this hearing, did not have confidence that Mr. Kennedy would be the one to lead us to a better future. Thank you.
Thank you, Senator Welch. That concludes the remarks that senators have requested to make. And hearing nothing further, I'd like to thank all of our members for attending. This Finance Committee stands adjourned.